Well, Mother's Day marks the start of National Women's Health Week, an important awareness week that sheds light on women's wellness. And here to discuss some important screenings and questions that women should ask their doctors at different phases of life, Dr. Meghan Klavans. Thanks so much for joining us.
Of course.
Well, you probably run the gambit as far as age ranges and people who come to see you and the questions that they ask, right?
Yes, that's true.
So what are some of the big three concerns that run across all age ranges?
Sure. So some of the bigger concerns would be things such as abnormal pap smears, cervical cancer. Cervical cancer is diagnosed in about 13,000 women in the United States annually. Breast cancer, a woman's lifetime risk of breast cancer is about 1 in 8. Fibroids, endometriosis is a common one, and that's more than 3, I guess. But
yeah, but those could strike at any age range.
Correct.
What kind of screening should people be getting? You mentioned the breast cancer screenings, and the ages kind of differ on when you should actually go for your first one.
Sure. So in general, we recommend that women come to us for an annual exam every year for a well-woman exam. This allows us to perform a physical exam, discuss the screening guidelines, immunizations. So in general, things such as gonorrhea and chlamydia screening are recommended in all women that are under the age of 25 who are sexually active and those with risk factors. The HPV vaccine, not necessarily a screening guideline, but more of a vaccine recommendation, recommended for all men and women ages 9 to 26, and actually as of recently the FDA has approved the vaccine up until the age of 45.
9 to 26, and like if you have school-age children, you may notice that they tell you make sure that children get the HPV vaccine. What exactly does that vaccine do?
So this vaccine covers the human papillomavirus. It covers 9 different strains of it. And the human papillomavirus is what's responsible for abnormal pap smears, cervical cancer, genital warts, anal cancer, oral cancer.
Mm-hmm. When does a teenager, for instance, a teenage young lady, actually have to come see you, starting out with those annual checkups? What age is best?
We would recommend somewhere between 13 and 15, and we won't necessarily perform a pap smear or a pelvic exam or breast cancer screening or anything like that, but just allows the patients to establish a relationship with an OBGYN.
You also see a lot of people talking about uterine fibroids, and that kind of, I guess it doesn't stretch from all ages, but as women get older, that's a concern?
Yes, and often they'll present with irregular bleeding, heavy menstrual cycles, painful cycles, and some women are completely asymptomatic.
Are a lot of women just scared? Scared to come to the doctor sometimes, number one, scared to ask the pivotal questions because they're afraid something's wrong? Sure,
yes, I think that's very common, but we encourage women just to be open and honest, and we're non-judgmental, and we just like to help.
The doctor visit when you go in, especially for just the annual exam, every year for pap smears?
So pap smear screening is recommended starting at the age of 21, regardless of your sexual history. And if they're normal, we're actually doing them every 3 years in your 20s. And when women are in their 30s, we'll do them every 5 years, along with an HPV test.
Perfect. Dr. Klavans, thanks so much. If you haven't had your checkup, go to the doctor. All right, thank you. All right. Time now.